so much, Fidel. Well, former President Joe Biden has been diagnosed with an aggressive form of prostate cancer that has metastasized now to his bones. And joining us now to talk more about it, we have Dr. Rupesh Parikh. He's with Comprehensive Cancer Centers of Nevada. Doctor, thank you so much for joining us. Of course, this has been a big headline ever since the news broke. Can you explain to us what is prostate cancer and what does it mean if it's in an aggressive form?
Sure. Thank you for having me. Prostate cancer is a cancer that occurs in men. About 1 in 10 men get it. About 300,000 new cases every year typically occur. Usually it grows very slowly, but sometimes it can be aggressive, just like President Biden's. And those require treatment pretty immediately.
Yeah. I think it begs the question, you mentioned that it grows slowly, yet here we are finding out about it when it's already considered aggressive. How is it possible that a former president of the United States, that his cancer could get to this point when he has access to some of the best medical care in the world?
Sure. I mean, while symptoms are, intermittent, as men get older, they have, trouble urinating. Usually sometimes they have blood in the urine, but if you don't have any symptoms, we don't tend to screen for prostate cancer unless it's with a blood test or a digital rectal exam. And I can't comment on if he had these done or not over the last few years or not. But it was, worrisome to see why he didn't get diagnosed earlier.
Yeah, it is very sad to see. And when you hear that it's in stage 4 and that it has metastasized, can you tell us what kind of prognosis would that normally be?
Prostate cancer, when it metastasizes, usually goes into the bones, but can spread to other parts of the body as well, the lungs, the liver, lymph nodes. We don't know the extent of where the cancer is metastasized, but I do believe that it is in his bones. And if it's in the bones only, he should do well with what we call hormone-based therapy or radiation therapy or sometimes even chemotherapy. But prognosis with stage 4 prostate cancer can be anywhere from 2 years to 5 years, depending on how he responds to therapy. Because of the aggressive nature of his disease, it can be a little lower, and depends on how long he stays in remission after we treat him initially. So.
Yeah, it's good to hear that there is treatment available, even if it has reached the bones. That said, prevention is always key, right? So what can men do to protect themselves from it in the first place?
Yeah, so as men get older, especially beyond the age of 45, 50, if they're having trouble urinating, they should go get a digital rectal exam and ask their doctors to run a PSA test. But, healthy lifestyle, low-fat diet always is good. And managing weight also helps reduce the risk of prostate cancer.
Yeah, it's unfortunate to hear this type of news about, someone who used to run our country. But at the same time, do you see a silver lining here that more people are talking about this and perhaps bringing more awareness to this disease?
Certainly, because prevention is huge, right? The earlier we catch the cancer, the better the outcomes. Sometimes when we catch it super early with prostate cancer, we just watch these patients for a very long time before they even need treatment. But you have to know you have it to watch them. So, pay attention to symptoms, frequency, difficulty in urination, dribbling, blood in the urine are very common symptoms.
All right, Dr. Parikh, thank you so much for giving us these life-saving tips, and hopefully folks are listening to it and taking heed and will do everything they can to protect themselves in the future from this horrible disease. Thank you so much for joining us.
Happy to help.